Order! Order! You are an incorrigible delinquent at times. Behave yourself, man!
Zeb, thank you. We've always known that the death toll from coronavirus would be revised up, but the figures out today from the Office for National Statistics make for grim reading, and particularly in the way they apply to care homes. Nearly 5,000 people died in care homes in England and Wales in the week up to 10th of April. Now, people die in care homes all the time, but that number is double the deaths per week than the month before. And of those extra 2,500 people, only 800 had COVID mentioned on the death certificate. So why did the rest die? Were they undiagnosed COVID or people who might have survived if they could go to hospital? The ONS figures show that across all ages there were 8,000 extra deaths in England and Wales than in a normal year, and of those, 80% were diagnosed as having COVID. As expected, these official numbers are higher than the hospital deaths announced by the government every day. They're about 40% higher. Now, we don't have comparable figures for Scotland, but we do know a quarter of all Scottish deaths linked to COVID happened in care homes. Nick Stripe from the ONS talked through the latest death figures for us.
If we look at those overall numbers for deaths registered in the week ending 10th of April, the 10th being Good Friday, the total number is 18,516 deaths registered across England and Wales, which is over 2,000 higher than last week and is now 8,000 above what we would expect to see at this time of year. The reason for mentioning Good Friday as well is because registration offices tend to shut on public holidays. Some of them stayed open this year. We think about a third stayed open, but that means that actually this number of death registrations is smaller than we would have expected. So it's probably underestimating really what would have happened if it hadn't been a public holiday on Good Friday. Given that, despite that, we are up on last week, we are 8,000 above the 5-year average, and we're at unprecedented levels of deaths for this time of year. The fact that we're seeing those figures now is what jumps out at me. If you remember last week, we were seeing about 1 in 5 of all deaths mentioning COVID on death certificates. Now, this week it's 1 in 3 of all deaths. So it's over 6,213 deaths involving COVID. So that means in terms of that proportion versus that excess 8,000, if you like, above average, last week it was about 3 in 5 were involving COVID that were kind of those excess deaths. Now it's 4 in 5 involving COVID. So from 60% to 80%, which is quite a big jump in that number.
Can we turn to care homes? Because there it seems that is a rather startling jump in the number of deaths taking place in care homes.
Yes. Again, last week when we looked at this, we were talking about 217 deaths had been registered involving COVID in care home settings, and it was about 5% of the total number of COVID-involved deaths. That's now gone up to 13% of all deaths, and in terms of that number has gone from 217 now to over 1,000. So that's 1,041 deaths registered by the 10th of April. And so these were deaths that were probably occurring a few days before that, so very early in April.
OK, but there were, in that week, there were, nearly 5,000 deaths in care homes. Now, you'd expect there to be deaths in care homes. From the look of these numbers, that is that is double the month before. And of that, not many relatively appear to be allocated to COVID.
That number, 5,000 deaths registered in care home settings, is about double what it was, not only a month before, but 2 weeks before. It's about double what it was. Now, in context, it's not that different from hospitals. So hospitals are about 70% above what they were 2 weeks before. 17% of those deaths in care home settings mention COVID on the death certificate. So some of the things we need to understand are like, what are these complex pathways that exist between hospitals, care homes and private homes? What are they normally? Have they changed? Are they changing through the course of the pandemic? And can we start to draw any conclusions from that? So, for example, would it be the case earlier in the pandemic that care home residents may have been more likely to be transferred to hospital from their care homes if they were falling severely ill from COVID? Could it be the case now that care home residents who normally would be transferred to hospitals for other reasons are now tending to be kept in their care homes and therefore dying in care homes from other causes? These are some of the issues that we can't tell from death registrations yet, but we're hoping that the data that the Care Quality Commission are now collecting on a more timely basis from care homes. So this time next week, what we're hoping is that we'll have been able to work with CQC looking at that data stream they're now getting to understand its nuances.
Nick Strike from the Office for National Statistics. Well, just as we did last week when the ONS produced its weekly figures, we approached Sir David Spiegelhalter, who's Professor of Statistics at Cambridge University, to make sense of them for us.
It's on the death certificate, and that means, and it can go on even if it's suspected COVID. So it goes on as an underlying cause of death. It would very rarely, in a few cases, be solely because of COVID. COVID is a nasty virus that exaggerates weakness, that any vulnerability you've got. The risk profile of people who succumb to COVID, the age gradient of COVID risk is pretty well exactly the same as the age gradient in our normal life. It's the frailty of the individual that's important. Now, there are other factors that seem to interact with COVID. It's suspected they might. Ethnicity, we suspect that healthcare workers who are exposed to a very high level of infection also have an extra risk over and above the normal risks they'd have.
OK, so let's turn to those 1,800 extra deaths that are non-COVID. I suppose the first thing to say, might some of those be COVID? They just haven't perhaps been identified as such.
There's three possible explanations that people have come up with. The first is that, yes, there's COVID deaths, for example, in very vulnerable, frail, older people, but who might even, just with a very mild form of the disease, which doesn't give you strong symptoms that would be identified as the disease, still be sufficient to lead to your death. And that kind of is reinforced by, I think, some of the care home data. And they may be dying with COVID, and it's not going on the death certificate because there's no good evidence for it. And a good doctor who's completing the death certificates, responsible doctor, needs to ensure that when they say suspected COVID, there is good reason to do so. So there's some evidence there, I think, that there may be people dying with an infection of COVID, but the symptoms aren't sufficient for it to go onto the death certificate.
Because there are so many extra deaths in care homes.
Yeah, there are. There's double the number of deaths in care homes than there were a few weeks ago. That's one possibility. The other possibility, of course, which everyone has been really worried about, is that the extra deaths might be people who haven't got COVID at all, but are not going to hospital in spite of the fact that they have got some symptoms of a severe disease. We know that there's far fewer admissions to hospitals going on. Attendances at A&E have dropped enormously, to the extent that people like Chris Whitty have said, hospitals are still open for business. Please go along if you have got chest pain. People are very reluctant to go to hospital. There's always this possibility that there are at least some cases one might think are avoidable deaths because of the fact that the healthcare system is so disrupted.
And that would be the only other explanation for those 1,800 extra non-COVID.
Yes, either they have got the infection and they're not being labelled because people aren't confident enough to put it on the death certificate, or they haven't got the infection, and in a sense this is collateral damage of the process we're going through.
Professor Sir David Spiegelhalter. Well, Sam Monaghan is Chief Executive of MHA, which runs 222 homes in the UK for 7,000 residents. They've had over 200 deaths related to coronavirus so far. Good afternoon to you.
Good afternoon.
And have you had more deaths than you would expect that are non-COVID?
I mean, what's really difficult with this is that we would say there's been between about 60 and 70% more deaths that we're experiencing than we would normally experience at this time of year. The other thing that's really hard is until recently, the only deaths that were being reported as COVID were those where our residents had actually gone to hospital and died in hospital. But we've been given advice by GPs that in many of our homes, if we've had a case where somebody has died of COVID, then any subsequent deaths need to be recorded as suspected or as suspected as COVID-related deaths. So it's been a very problematic issue, and we're still not being advised as to how actually people want us to count these deaths. The other problem is that in quite a number of our homes, GPs are no longer coming in, and so actually what is happening is consultation over the phone. And so we have not got medical experts making these final pronouncements in terms of causes of death.
So who's writing the death certificates?
The death certificates are being authorised through the homes, actually, well, through the GP, but through the GP not coming into the home.
Right, so somebody in the home is writing it.
Yes, so they're having to do that, and then obviously liaise with people like undertakers.
We had heard from somebody that there was a suggestion that actually families will need to start writing death certificates. Have you heard of that?
That hasn't happened to my knowledge in any of our homes to date, no.
Okay.
But obviously that would be a very hard ask in what is already a very traumatic situation.
Indeed. Now, what is the situation with regard to the health of your residents, given that GPs are not able to come in and given that everyone's reluctant to go to hospital at the moment, whether they should or not?
Well, it's very hard because we've had many GPs and also district nurses, because of their risk to themselves and to other patients, no longer coming into our homes. So what we're having to do is conduct discussions with them either by video or over the phone in relation to any symptoms that our residents are presenting. And clearly we do have some nursing homes where we have nurses who would be more skilled in doing that, but in our residential homes, then clearly we are very reliant on the way in which the staff are able to talk to the resident and to the GP or district nurse regarding any symptoms being presented.
Just briefly, would you like to be sending more of your residents to hospital when they get ill?
When they're acute, we're not having a problem sending them to hospital, but I think it's this intermediary area where we really need them to be seen by GPs and medics in order to make the assessment, the appropriate assessment regarding their condition.
Sam Monaghan, thank you very much. Well, listening to that is Liz Kendall, Labour MP and Shadow Minister for Social Care. Good afternoon.
Good afternoon.
What do you think is the answer here as to how we handle this in our care homes?
I firstly think that we do have to try to get these figures published daily. I still worry that we are very behind the curve here. The figures from the ONS are shocking, but they are still 12 days too late, and I think that is important because we need to know how big the problem is and how quickly it's spreading if we're going to tackle it effectively. Secondly, I think it's extremely important that we get the system working better so that there is proper medical support. I think what you heard from everyone who's spoken so far is, care home staff are under huge pressure, being asked to do things that they may not have been asked to do in the past. We need to make sure that individual decisions are made about whether residents who could benefit from going into hospital are actually sent to hospital. Unfortunately, we have seen examples in some parts of the country of GPs writing to care homes saying that the residents won't be sent to hospital because none of them will benefit. I think that has to be done on an individual case-by-case basis.
So
and
should
we've also got to make
GPs
sure...
be going into the... I mean, you heard Sam Monaghan there say the difficulty is that GPs are not going into care homes. Should GPs be going into care homes more than they are?
I think that in parts of the country, GPs are going the extra mile to provide that support to care homes. I think we need to see that on a more uniform basis, because my worry is here that care homes are being asked to do sometimes things that are very different from what they're normally doing, and they need extra support, including from GPs.
And that is in the first instance
from
GPs.
Yes, but also from the hospitals too. Look, initially we had a situation where people who were being discharged, elderly people who were being discharged from a hospital, weren't automatically getting tested. Now, if you send someone who possibly has coronavirus back into a care home, that may mean it would spread very quickly. So we need to see what is sometimes called step-down services for elderly people who are tested positive for coronavirus, because it's not always possible to effectively isolate them in care homes. Some councils are working with the NHS locally to do that, but we need to see more of those services developing. What works will work differently in different parts of the country, but it is not right to be asking care home staff to be doing things without the proper support that they need from medical professionals.
Okay, Liz Kendall, thank you.